Kia ora. I'm Chris Bullen. I'm a Professor of Public Health at the University of Auckland. For the past 20 years, I focused my research efforts almost exclusively on addressing the challenge of tobacco smoking. But why bother if smoking's on the way out? I mean, smoking rates in New Zealand are now at historically low levels. Well, we are, as a nation, aiming to be smoke-free by the end of this year, and by smoke-free we mean 5% or fewer of all New Zealanders smoking tobacco. About 85,000 New Zealanders need to quit smoking in the next 9 months to meet that target. That's quite an ambitious target. But low levels of smoking certainly wasn't the case 20 years ago. And it isn't the case for all New Zealanders, and certainly not the case in many countries where millions of people still smoke. It seemed to me 20 years ago that we in New Zealand were the perfect setting to undertake high-quality, large, pragmatic trials that could inform tobacco control policy, that could inform clinical practice and improve it, and expand the options for people who wanted to quit smoking. And I personally was on a bit of a mission to achieve a broader public health impact with pro-equity approaches that address disparities and promote inclusive, accessible smoking cessation interventions. But back to tobacco. There are very few products I can think of anywhere apart from cigarettes which have such an impact on people's lives and health. Every cigarette a person smokes reduces their life expectancy by 20 minutes. Smoking causes 10 to 30% of cardiovascular disease. At a global level, we're talking about around 1.3 million people dying every year through secondhand smoke alone, and the costs globally exceed $1.4 trillion a year. That's almost 2% of global gross domestic product. Cigarettes kill half the people who use them long term. There is really good news, however, to go alongside that bad news. Quitting tobacco smoking reduces the risk of smoking-related diseases and premature death dramatically. Quitting smoking at 30 years of age increases your life expectancy by a decade. Quitting at 40 and 50 years of age increases life expectancy by 9 and 6 years respectively. Smoking cessation reduces the risk of having another heart attack by 50% in patients who have already suffered a heart attack. I can't think of another intervention that is so rapidly and profoundly impactful. And so my research has focused on developing, trialling and summarising the evidence about innovative ways to help more people who smoke to make more quit attempts and have a greater chance of sustained success. With my colleagues in Auckland and internationally, I've led or supported many trials of novel approaches to quitting smoking and synthesised the global evidence on cessation aids such as e-cigarettes, mobile phone messaging, and different ways of using existing nicotine replacement therapies. My lab is the community. The participants in our studies are the thousands of people who smoke, mostly in New Zealand, but our research has extended to trials in China, India, and Malaysia. Many people have quit smoking because they were willing to take part in our studies. For their contribution, I'm deeply grateful. Somewhat controversially, I led and published the first research pointing to e-cigarettes as a potentially effective smoking cessation tool. Then I led the world's first randomised controlled trial of e-cigarettes for smoking cessation. I've continued to explore many aspects of these products, both the good and the bad. Last year I oversaw work on guidance for health workers in New Zealand to support people to quit e-cigarettes. I've also showed that minor changes to the scheduling of nicotine patches could enhance their effectiveness by almost 20%. That inexpensive personalised letters from GPs to their patients who smoke could prompt them to have a go at quitting using included nicotine gum. And through my PhD students, I've been able to trial a range of novel approaches in a number of countries where smoking continues to be considered normal, despite overwhelming evidence to the contrary. For example, in China, we created and trialed a pilot of a free quitting program called Scampi, embedded as a mini-app in the widely used WeChat social media platform. It has a huge reach to the Chinese population. It supported Chinese men to quit smoking, sustaining their engagement through culturally aligned micro-incentive payments, and validated their quitting using test kits delivered overnight to their homes and observed using video. In complete contrast to that high-tech approach, in South India, we developed an intervention that involved a simple change in systems and practice in rural hospitals, having doctors simply ask patients attending the clinics about smoking and offering counselling to quit. Combined with a smoke-free homes policy delivered by community workers, it increased quitting rates amongst rural indigenous people in southern India. Currently in Saudi Arabia, we're testing an SMS messaging program for Muslim people who smoke cigarettes or shisha water pipes, and it uses religious and health messages translated into Arabic. Back here in New Zealand, we are making real progress with tobacco control. It's possible we could reach our smoke-free 2025 goal by the end of 2025. That would be wonderful. And globally, there are some signs that smoking is declining. But we shouldn't underestimate the power of the tobacco industry to interfere and disrupt progress. A current project I'm leading for the Ministry of Health involves monitoring illegal tobacco and illegal vape sales in New Zealand as our policies change. We're witnessing a raft of new nicotine and tobacco products being promoted and sold online, incredibly some with the support of government, despite no evidence they help people to quit smoking. Smoking and other forms of tobacco use are not going away anytime soon, and more research is desperately needed to investigate more effective ways to support more people here in New Zealand and the millions of people around the world who are literally smoking themselves to death. We need to find out more ways to help them quit smoking and save their lives.